Linda Hayes and Dr. Melvin a couple of years ago, and we had an incredible interview where we talk about fascinating things, especially the role of thermography on detecting early detection of breast cancer and many other incredible subjects. Now, we have a lot of questions, and I will start with the first one. I just am very eager to hear the wisdom and the years of experience that Linda and Dr. Melvin have. I want to mention for the people in the conference call that you need to press star, what was it, star 5?
5 star. Star 5. 5 star.
5 star? Okay, 5 star. The people in the conference call, the people who are calling over the phone, you have to press 5 star and we will know that you want to ask a question. The first question from Shelley. I want to mention that there is a lady from Netherlands who runs a holistic practice. It's called the Nutrition Doctor, something like that, that she sends several interesting questions, very interesting questions.
Hey, Carlos, are you recording the sleep?
Thank you, Brian. Is this working?
Yeah.
Everything else? Anything else?
No.
All right. Can Dr. Melvin provide us with a list of other services he has trained? What questions should be asked in the office to ensure the best outcome?
Okay, ask that a question again.
Yes.
So to be clear.
Can Dr. Melvin provide us with a list of other offices he has trained, people that you can train, have trained? What questions should we be asking the office to ensure the best outcome? I guess, I believe that this is a person who have never had thermography and they don't know which one is good, which one is not. In my experience, ladies and gentlemen, people who practice thermography are people with honesty. This is the reason they are doing that. So, if you don't have any other, just try. So, but Dr. Melvin will ask.
Yeah, we have a list of cameras. Denmark, we have and technicians in multiple areas of the country. We have one in New York. We have a couple in New York actually, and then there's Louisiana. You would need to call the office, but we have them all throughout the U.S. And so the questions that you would ask is what kind of reader, what kind of reader is reading the imaging, and how long have they been reading. Much of the reading that I started off since '91, the strategy of the examination is quite different today.
Can you hear well here?
Than how we were examining thermals in the past, where now there's more of an integrative point of view with the imaging, which obviously the breast imaging would not be a comprehensive exam where you would still need at least a full torsal view to examine the liver, gallbladder, digestive tract, stomach. Imaging would not be, and so you so often just examining the breast as if they are independent appendages, I find lacks the proper full evaluation regarding the breast. So what we include with our breast imaging is a full torsal exam. And in many cases, we do a full body examination, which includes the visceral, the spine, the head and neck. And so those would be some of the questions you would ask when identifying what kind of reader is the reader. Chiropractors frequently make good readers because of their background in general physiology and their general anatomy, and neurology is very helpful when reading.
So Carlos, when they call, they can call our office. It's Total Thermal Imaging, 619-303-5884. Ask them for a list and like Dr. Melvin said, make sure that they ask if they do a full, a full torso. Because like he's saying, we know, and when you talk to us, that a lot of breast cancers can start periodontally, thyroid, hormonally, lymphatically, digestively.
Yeah. So when you back up, in fact, even on the full torso will include the head and neck in the imaging. The reason for that is frequently there's correlative thermal markers related to dental issues that coexist with the breast cancer on the same side.
All right.
Yeah.
So I'm going to go to the next question. Jeff Herbert. Can a thermal scan differentiate between a cancerous prostate and an inflamed prostate, especially in the absence of a biopsy? What I understand, cancer is inflammation, and this gentleman is asking to differentiate when there is an inflammation that is not cancer.
Yeah, you would not be able to differentiate whether it's cancerous or not. On a thermal, you would see that the inflammatory levels, which is above the pubic region, related to inflammatory features affecting the prostate. But really, the question isn't whether it's cancerous as much as what causes it to be cancerous. And much to do with the prostate actually has to do with a chronic digestive disorder where they are producing a flora that is not only inflammatory to the digestive tract, but as the kidney filters the waste products made by those organisms and the colon, it gets filtered out by the kidney, then dumped into the bladder, then from the bladder through the prostate, sets the stage of affecting the inflammatory effects to the prostate.
And it will be mainly here. You monitor the other two. Okay, I'm sorry.
Sorry.
I have another question. Jim Berger. This gentleman asked this question on another Q&A. I mean, not exactly the same. It's a very thorough question. I am a 63 years old male individual in good overall health. However, I have noticed subcutaneous bumps in my groin, axillary regions and arms. Ultrasound scan on the groin 2 years ago found the following. I cannot read this. I think I sent you isoechic hyperoic, I don't know. Structures. Okay. Yeah. This is like the junk food for me, or the ingredients on the junk food, I cannot read them. Structures within the subcutaneous tissues in the bilateral proximal tights. These measure up to 1.5 centimeters in the right and 2.3 on the left. At least 2 right-sided lesions are seen, and at least 4 left-sided lesions are seen. Appearance suggests small lymphomas. Impression, etc. Would you suggest having a full body thermography scan at this point, or a biopsy on one or several of the lumps?
Yeah. I would say to see the groin and the axilla are target areas that have high content of lymph nodes in those areas to help filter out products that are getting into from other areas. Now, the groin is classically has these lymph nodes in order to clean up what comes from the lower extremities for the most part. But the axilla, again, these lymph nodes are have little Pac-Men in them to address whatever is getting into the lymph system. So I would say that when you're doing a visceral evaluation, would be the first study that we would do. A visceral study would be a 360 around the entire full torsal region. At the same time, though, you would still need to see what's going on in the lower extremities, because the groin area is inheriting something from the lower extremities that is affecting the lymph nodes. So we would call this a lower body study. is how it would be termed. So cost effectiveness would be that you would do a full torso examination where the arms are lifted up in order to see the axilla when you do the study. And then yet you would still need to include the lower extremities to see what inflammatory features that are going on in the lower extremities. And so that way we can see what is being forwarded from the lower extremities to the groin, and then from the groin to the axilla of the armpit. So lower body study.
Okay, perfect. Now we have a call from the free conference call that I will increase the volume here so everybody can hear. Erin, you have a question. Erin, your phone number ends with 3029. Go ahead, Erin, we can hear your question.
Hi. Yeah, thanks for taking my call. I've been getting thermography for probably, excuse me, 3 or 4 or 5 years. I have had breast cancer, and they, of course, wanted me to do all the mammograms and all those things. And after having the breast cancer, I said, no way, no more. But after listening to you a little bit, I guess I just want to, how does one know that the thermography they've been having is as good as it can be?
I would say that some of the protocols of the examination of the breast themselves, we use an analysis where we use an ellipse examination to address what is the temperatures from right side to left side. But I think the major emphasis is not as much of finding cancer as much as finding what are the contributing factors that is causing the cancer. And when you address those issues, which simply what we're looking for is lymphatic congestion, inflammation, and estrogen dominance. These are the 3 equations that are not seen on a mammogram, not seen on an ultrasound, not seen on a CT scan or MR. So what we're examining are what is setting up the stage that produces the lesion. The lesion doesn't exist by itself. The emphasis of finding lesions is not as important as its metabolic characteristics, which is not seen on an MR, CT scan, or mammogram. So you say, well, what is the metabolic characteristics? Well, it gives us an idea of its aggressive behavior. So in many cases, you don't see the lesion, you see the feeding of the lesion, which gives you an indication regarding its aggressive behavior. So much of the terminology is used is more about what is the setting. Now, 70% of breast cancer occurs on the left breast. 70% of it between 12 and 3 o'clock. Why? Well, that's where the blood and lymph from the breast goes to the axilla, from the axilla to the neck, and then it's recycled to the heart. Well, what is the common denominator? It has to do with arm dominance. So where breast cancer actually has nothing to do with the breast as much as the ability of the blood and lymph to get out of the breast, which is predicated on how tight the scalenes are in the neck, which is a compensatory response of a right arm dominant individual. Also, it's suspect that the over-application of deodorants, especially antiperspirants, on a right arm dominant individual tend to overload the left axilla or left armpit simply because of arm dominance. So these particular fundamental features are what we're addressing is what sets the stage that allows cancer to exist to begin with. And,
I want to say something. Once they understand this, go ahead.
No.
Go ahead. Go ahead.
Go ahead.
Go ahead.
Yeah.
Are you talking, Linda?
She's
Oh.
talking.
No, I don't hear anything. Erin, are you...
I don't hear anything.
I can hear her speaking.
Oh, okay. hold on a second. Maybe I should mute. Erin, if you finish your question, I will mute you. Is that okay?
Which office?
How do they know that their thermographer person is quality?
Well, like Dr. Melvin said, I mean, ask them how long they've been reading, and then ask them if they do a torso picture. Usually.
Yeah. The other facets is we do a 6-image study of the breast. Basically, those 6 images, we're comparing the initial image to the last image to see how well the body responds to the ambient air. Now, cold stress study, which is a procedure where you put your hands into cold water, has been used, but there's a number of readers have found that it tends to muddy the water, so to speak, and tends to confuse the overall examination procedure. So what we use is we examine the first image to the last image and compare its reduction in intensity of the heat emissions to identify a proper autonomic response. So that is our cold stress study. So my first answer to you regarding what are you asking for is do they include full torso evaluations? Are they doing, what is the measuring capability? If they're using a cross-hair examination, which is an older form of examination instead of a temperature average examination of the breast, which is what we use.
Erin?
I mean, the one that I do, I'm just in the cool room, and she just sets up the camera and goes. So
Yeah.
I don't know.
Yeah. See, which the room temperature ideally should be 68 to 70. We tend to keep them at a 70-degree temperature evaluation. That way, when we re-examine the patient, we like to keep it at the same and mimic the circumstances the prior. Now, most of our measurements are done on the oblique view. Oddly enough, a lot of the examinations are done on the anterior breast view. We do not do that. Because the nipple is not faced in the camera, that most of our examinations are done on the oblique views. So those would be questions that you would ask, well, do they show you the images? Now, in our imagery, we have our images and reporting are on the same page. They're not separated, so you could ask regarding how is the report portrayed? Do they show where and what was examined in the imaging? And in many cases, they do not show you that they examined the nipple. In many cases, it's very difficult to see the nipple. So in those cases, the technician is asked to have the patient point to the nipple at the conclusion as an added image. So then we're making sure that we're examining where the nipple is in the global temperatures, the overall temperatures. As obvious as this may seem, many reports do not show you what was examined.
And another thing, you can call our office. If you go to one of our certified locations, you know that you're getting the thermal imaging that Dr. Melvin is describing. Yeah. And he has been reading for quite a long time. He's pretty amazing. I just want to say something, Carlos, to women. Teresa and I just spoke at a fitness center. Their big fear is cancer. But like Dr. Melvin said, it's really not about that. It's about what's causing that or what the precursors are to that. And I think we can really take the deer out of the headlights once they understand that, they get over that fear. A lot of people don't even want to do the thermal imaging because they don't want to know they have cancer, which is crazy. Yeah. So what's nice is I tell them we've got to get that fear out. It's just been programmed in them. And, even our office, you can come in, you can check it out, you can have a free face scan, to make you feel comfortable and understand how thermal imaging really works. We're looking more for what's causing the problem down the line.
Yeah, see, I think the motive is Carlos, is a totally different motive. It's not finding cancer as much as finding the environment where cancer can live. And so when you address those particular features, which is inflammation, lymph congestion, when tissue begins to bathe in its own waste, it sets the stage of cancer. So when you can't see those on a mammogram, basically what you're getting on a mammogram is a waiting game of the circumstance of cancer instead of addressing the precursors to avoid the cancer.
Yep, and again, this is one of my favorite subjects. What is the root cause of cancer? In your experience, you said many important things right now. It's the environment, it's the fear. It's the fear that was created for many things, for the propaganda, for these actors who did a surgery, unnecessary surgery, and young women had fears, or for the unnecessary biopsies, or maybe because the mammogram shows a different area that could be a calcification but doesn't mean it's cancer. So that all contribute to that. So and one excellent way to get out of that fear is to go and have a thermogram. And if people say, I don't have insurance, the thermogram is $250.
Yeah.
So what is more important, your health or the fear?
Yeah.
All right.
Yeah. Yeah, and I think these calcification target characteristics, I mean, inflammation, any part of the body that has a chronic inflammatory response, its response is to calcify the area to stabilize the tissue. That is the end phase of inflammation. And in many cases on a thermal, it's already run its path and has already stabilized the site. And yet this process of biopsies, opening the site, opening and subjecting the patient to what would have been already an encapsulated, well-encapsulated lesion, now has been opened by the doctor. So.
All right. Let me go to the next. Okay, let me go to the next question. The next question. Here we have Cristina Santini. She's I don't know exactly the naturopathic or nutrition specialist from Denmark.
Oh, yes.
We know her well.
Ah, you know her? Fantastic.
Yes, we trained her. Hi, Christine.
It's a small world.
She's adorable.
Fantastic. Okay, she has many questions. Maybe I don't know if you can answer all of them. I mean, if it's appropriate, because we have so many. What does low kidney function look like on thermography? And is this viewable before it shows in a blood lab?
Yeah. The kidney for thermography is one of the few organs that are identified both from the front and from the rear, even though the kidneys are much closer to the spine. Basically, when there's a breakdown affecting the kidney, you'll get an inflammatory that tends to fit the pattern of that organ. Again, you have to think that thermography is very much like looking at a panel on your car. When the oil light goes on, you really don't see the engine, but you know that there's a problem with the engine. So the skin basically is hot-wired to a part of the brain that controls the blood flow to every muscle, organ, and gland. And when there's a change in proper blood flow to that organ, it immediately changes the skin temperatures simultaneously. Since the skin and the central nervous system, the brain and spinal cord, originate from the same fetal tissue. So simply, what is outside of the body is directly hot-wired to a part of the brain that identifies the blood flow to every muscle, organ, and gland. So as soon as there's a change in that blood flow to that organ, it tends to produce a heat pattern consistent with the body part involved, whether it's a muscle, whether it's an organ, or if it's affecting the lymph system, or it's affecting some of the other parts of the circulatory system as well.
All right. I want to mention, you know, I have to, for people on the conference call, if you want to ask a question, press 5 star, no, star 5, no, 5 star, right?
Right.
5 star, so I see in the computer that you want to ask a question. If somebody on the YouTube stream asks, she says that, would be great if this could be reviewed afterwards, providing opportunity to share it with others. That shows the importance of what the conversation we are having. And I want to tell you, Anne, that all this information, the other 2 Q&As that we have on thermography, along with over 100 videos of interviews that I've been doing since 2016, are available in our membership area for just $12.95 a month. Mm-hmm. Believe me, it's so worth it. What is more important? To spend a little money on health, or to have a situation later that is way more costly. So I want you to consider, Anne, it's just $12.95 a month, and you will have access to incredible information. Mm-hmm. Let's go to the next question from your friend Cristina Santini. Mm-hmm. What does adrenal fatigue look like? Mm-hmm. And is it possible to determine what stage is it approximately with a thermography?
Yeah, adrenal failure, again, the adrenals are just above the kidney, so they tend to show up as a colder heat pattern consistent with the adrenals. So usually they're bilateral. It's rare that they would be unilateral. It's rare to see them only on one side. But what they show up as on the skin temperatures as a colder pattern consistent with the adrenals. So that's how they would be viewed.
All right. I'm going to ask a question from some other person, then we come back to Christina. I asked Christina, I sent an email if she could be present because I don't understand some question. Yeah. Liz Morris, she asked, what are the cost and time frame involved to become a certified thermography technician, and what is the cost of the device?
Yeah. Did you want to answer that?
Well, that's a great question, and we do have classes quarterly. We're going to have one next month, July 21st and 22nd.
Cost.
Which is a weekend. It's $1,000, and that's 2 days of training. The first day is Dr. Melvin and all the practical use of thermal imaging and protocols and all that. And then the second day is actually hands on the camera. And we are doing full bodies. So we know that you know how to do thermal imaging by the end of Sunday.
And the equipment?
Well, the equipment, we have several packages. We have used packages from $10,000 to $15,000. We have brand new 300 FLIR cameras for $25,000, and then we have the 600 for $30,000. And that's the camera, the training, the computer, everything you need to do thermal imaging. And that's, Carlos, that's training for them and another person, an assistant, or them, the doctor and an assistant. And you know what I love about our company is that we're so hands-on. I mean, we're still working with people that were trained 5, 6, 7 years ago. And everything we have in all the training that we've done over the 30 years, we make available for everyone. Because we want them to be successful, and we want them to get the word out there on how thermal imaging is totally early detection.
No, after we're finished, obviously in 2 days you will not know the full extent of taking imaging. I would say it takes about 3 months doing imaging, and I mean I'm talking about at least doing 2-3 images through a work week. It does take practice, and so in many cases we can review their process through Skype, where they are sharing their screen with us, just like we're doing today with you, but we could share the screen. Oh, sorry.
That's fine.
This Toto. No, that's not Toto. So we review the imaging, where through Skype we can review and give some critique about how to improve their imaging. And so I do some of it, but a lot of it is done through Teresa, our daughter, and Linda. They will go through those images and critique their imaging, where if they either cropping a little better, but the focus, I would say the most difficult thing is actually obtaining good focused images, where pretty much everything else you could correct later, as far as correcting anything that was changed during the process. But I would say it's a 2-day class, but I'd say it takes 3 months to be proficient in doing the imaging, but you do have to practice.
We're with you the whole time.
Okay.
So remember that. We're hands-on. We'll
Okay.
never leave you or forsake you.
All right.
All we do.
Another one. Mary Ann, how do you find a good facility that does thermal imaging in your hometown area? Well, you know what I answered on that was a question typed in the web page. Google search online is the best way, and if you are in a small town, I don't know, but what do you suggest?
Well, yeah, I mean, there is a number of different companies out there that if you can call them to see who's on their list of that does the imaging. We're not the only ones, but contacting those groups, and they're pretty well seen. And if you're Googling thermography, there's a number of groups that are out there that you can contact, and then locate the closest camera to your area. And so.
And you can call us also. We have been doing it for 30 years, and we do know the questions to ask if you feel more comfortable with that.
Yeah.
All right, let's go to the next one. Dana, at what age should an otherwise healthy individual get their first thermal scan?
Yeah. Yeah, and this is a good question. I mean, obviously for women, during the breast development, you'll actually get an estrogen-dominant thermal findings that are normal in the development phase of the breast. So after they've gone through that, and usually that's 17, 18 years of age, depending on when they have completed the breast development. So what it would look like, which also what it looks like when a woman is pregnant, the estrogen influence of the breast is almost immediate. So thermography identifies those particular features. So for women, for examination, after the breast development, so 16 to 18 years of age, depending on when that is completed. If they're not sure that they have completed, we can tell them through the imaging that they have or haven't, because it shows that very distinctly on the breast if they're still going through the development phase. Once it's stabilized, then basically everything is still predicated on symmetry. So basically, we're comparing especially the nipple evaluations, the overall temperatures of the breast, tend to still show up as balanced. Now, Oddly enough, those that are breastfeeding, every once in a while we'll get a patient where they can't breastfeed through one side. So they will not have any vascular markers, estrogen influence of the breast. And you're thinking that what is in the breast, what is in the bloodstream should determine estrogen dominance. In many cases, that is not so. What the breast actually inherits on a monthly basis and its reactiveness may not be known by just doing a blood evaluation, but thermography you can. So we have breasts that sometimes women, one side they're breastfeeding, the other side inactive. And they have all the estrogen they need for the breast, but can only breastfeed from one side. Does it happen very often? No, but it does happen.
But I think what you said is very important because women all think that breast cancer starts at 40 to 50, right? So now we could start educating them earlier and get them off a blueprint where to go with their health. Because as Dr. Melvin said, even with estrogen, Carlos, we can get them to see that there's estrogen dominance and start working that 18, 19, 20s, 30s, not waiting till 40, 50s. Mm-hmm. So that's the exciting part about thermal imaging. You know, we don't have to be 40, 50 to do breast exam.
Yeah. And so there's other than that, we do children. Well, we do imaging for children. In many cases, those that are pregnant, you can do the imaging. It's just an excellent tool that obviously does no harm to the patient, but gives us a lot of detail about how well their body is functioning.
I am very curious, so I went to the internet and I googled the cost of the mammography equipment. It's between 200,000 and 500,000.
Yes.
No comments. I just wanted to let you know. All right. Let's see the other question, the next question. We are going to come back to Cristina Santini. She's talking about MSM, and I really don't know the
MSM,
but okay, this is interesting. Have you seen more brain inflammation in response to people talking on cell phones? Is something that you can see or detect?
Yeah, you know, and we've done some work with chips that for the EMF. I would say that much to do with head and inner ear issues are more than anything are eustachian tube disorders, where the eustachian tube is not opening properly. The eustachian tube is controlled by the 5th cranial nerve. So much of inner ear disorders with Meniere's and tinnitus, things of this nature, you can identify very readily the inflammatory features affecting the inner ear. But I would say the most common cause has more to do with the opening or closing or proper opening and closing of the eustachian.
All right. I want to remember people on the conference call that you have to press. Five stars. you learned it already. I have so many things. 5 stars if you want to raise your hand, and we unmute you to ask a question. Another question from Valerie. Can thermography differentiate between from malignant lesions and also local inflammation from cancer?
Yeah. So and you'll see that when mammograms are performed, it's interesting to me that terminology like malignancy is those terms are used within a mammogram. Which how do you know that it's malignant? The behavior of the tissue is assumed by its geographical characteristics, where thermography gives us more of as we talked earlier, more of a metabolic characteristic of the lesion, and then its contributing factors. Johns Hopkins University did a study where they did post-mortem autopsies on motor vehicle accident victims, and found that after they did the autopsies, on the average, most Americans have 6 to 9 cancers in their lifetime. 6 to 9 that they will live with, die with, but not necessarily die because of. So at times, for example, we have a patient that has a baseball-sized lesion in the spleen. Now, when we did the thermography, it didn't identify any metabolic characteristics that suggested that it was aggressive. Now, she did a CT scan originally and they found this particular lesion. And now, if you do a CT scan every 3 to 6 months, if the lesion was a non-aggressive lesion, you better believe as you keep doing a CT scan, it can change the characteristic of the lesion. So sometimes the tool that is used can change the outcome of the tissue that maybe initially had a non-aggressive characteristic. Well, this patient has been doing ultrasound evaluations every 3 months, and the lesion's been exactly the same size, and it's been almost 5 years now.
Now, I have an important question of what you were talking about. I just forgot. If so many people post-mortem with this research, they find that they have the cancer. There were 2 questions that I had. One, can that be detected with thermography? This cancer that is not developing, they don't have symptoms, but with thermography can be detected?
No, see, again, thermography is a physiological functional evaluative tool. So it doesn't have a geographically specific characteristic like an X-ray or an MR or a CT scan. And so the assumption that when you have differential characteristic of these lesions within the body, sometimes they've already run their limits. And so in this research with Johns Hopkins University, basically finding that frequently, if you've ever done autopsies, which when we were in college, you did dissection, and frequently you would see things that you wondered, how did this individual live? And so many of these anomalies, if the body doesn't kill the cancer, then it does the next best thing, and that is to encapsulate or restrict its aggressive behavior. So the assumption is what is in the lesion predicates its aggressive behavior. Well, you know, the body is killing cancer every day. Every day your body kills cancer. And some of them that can't kill, then it does the next best thing, and that is restrict its aggressive behavior. So I think what our importance of identify the contributing factors of lymph congestion, chronic inflammatory features affecting the body, addressing those issues and improving the digestive characteristics so the individual can feed themselves properly, that the person can develop the immunity to a level where they can address those issues. So are you familiar with Theobald-Smith's formula, Carlos?
No.
Okay. Theobald-Smith's formula, basically the severity of disease equals the virulence of the organism, which means the strength of the organism affecting human kind, the number of organisms, and the portal of entry, where did it get into the body, is all divided by the resistance of the host. So why are we all addressing on the organism instead of increasing the resistance of the host? I would say that our interest is more of improving the host's ability to defend itself, where the idea that you kill the organism, for example, even trying to kill Staphylococcus, so often that it developed a thing called hospital staph, and now is called Mesa. Where did it come from? Well, the overproduction, overusage of antibiotics. Now you develop an organism that frequently lives off of antibiotics. So
there is another very interesting question. Does insurance cover thermography? It's not. Is it expensive? I want to just mention in the other Q&As with thermography experts, some of them, they were saying that there is about 30% of insurance. And in my opinion, the more you ask your doctor, the more chances we have that they will be accepted. But can you answer this question? Does insurance cover, and what is the cost?
That's a big question always. Does insurance cover it, and what's the cost? Aflac does have it in their cancer policy. And I think it's like $25 extra you add onto your insurance. And they do cover a thermogram scan, a breast scan, because they'd rather pay for that than a mastectomy. So, and then also, a lot of PPOs do reimburse. But like you were saying, the expense really isn't that much. A full breast scan with the six breast and the torso, we have a lot of specials where we take 100 off, so it's $150. Some clinics it's $250, and that's showing you the anterior breast, the right left laterals, the torso. So you're getting a lot of information for that cost. And so then also we do women's health screenings, is which from the pelvic to the top of the head. Right now we're having a special that's $275, and we do full bodies from the bottom of the feet to the top of the head with 19 pictures. And this includes report, your pictures, your recommendations, and then what you do is you have a separate small fee to call Dr. Melvin, and he'll go over everything in that report with you. And that cost is $450.
But again, for everybody who is listening, and they will listen this video later on in our membership or in another summit, $250 is nothing.
Yeah.
Where do you spend that money? Like I think in the other Q&A they say, you don't go to Starbucks, or if you really are short of money or going to eat out for a while, and this is very affordable. What is more important? To have the peace of mind, to end up with the fear, do I have cancer or not, or just do that is so safe, and it's not invasive, it's not painful. So I think answering the question from my point of view, TK, even if your insurance doesn't cover it, it's well worth it. Okay, and he said, or he or she said, thank you, pretty reasonable.
Okay, bravo.
All right, another question. This is from a beginner, but I think it's very useful. What is thermography? What is a thermal imaging used for? Besides detection of tumor, what else can it detect? So if you could explain for...
Yeah, see, in much of our early work had to do with strains from injuries. So when you do an x-ray, you really can't see a whiplash injury, you don't see a sprain or a strain unless it has torn tissue to a certain level. So thermography identifies those responses. You can see neuropathies, where the origin is. So sciatica, for example, sciatica, which is a condition of the sciatic nerve, where the pain could be either in the lower back or in the buttocks, or it can go all the way down to the foot. But when you do an X-ray, MR, or CT scan, everything shows up normal But here the patient can literally crawl into the office to do the imaging and crawl out, and after doing an x-ray have nothing to say about where the origin of the condition. So thermography gives us an electrical point of view, so to speak. So you can see the extent of the neuropathy. You can differentiate between a plantar fasciitis, which is a condition on the bottom of the foot, to a neuropathy. Both can be painful, but one is neurologically induced, where the other is a breakdown of the arch of the foot that strains the bottom plantar fascia muscles. So here you have a tool that gives you so much detail regarding digestive characteristics. It was assumed that when you eat properly, that it doesn't guarantee that you process the food properly. So what we found with thermography is frequently the pyloric or the ileocecal valves were not opening properly. And so I come from a family of health-minded individuals, and so it was assumed that if you ate good food, you're going to be healthy. Well, you still have to process the food properly in order to assimilate it, in order to be nutritionally supported. So the assumption that you're eating good, that you should be healthy, in many cases, they're not. So we have a lot of vegetarians that don't digest well. And so the inflammatory features of what they cultivate in the digestive tract is very alarming with many of these individuals that just don't digest food in a proper format. So you have a wide range from a Bell's palsy, which is a neuropathy affecting the face. Again, we're talking about inner ear issues, sinus disorders that frequently don't show up on x-rays, that show up with thermography. So thyroid disorders, very common, more common in women. We're finding close to 70% of women are having difficulties with the thyroid, where they become somewhat dysfunctional.
Another thing that I learned lately, that mammography can detect areas of tissue that is not normal, and doesn't mean that that's cancer. Thermography can detect inflammation when mammogram could have a concern, but it's not cancer. Just to add to the people who don't know much about that. This is a very interesting question. It's interesting for me. I don't know. I think it cannot be done, but I just read it. Can a calcified pineal gland be seen via thermal imaging?
No.
No, because it's in the middle of the brain. And
again, you can't shoot through the hair. The hair is dead, essentially, so it has a much lower temperature. So as far as cranial imaging, it's a little difficult unless they cut the hair.
Yes.
So,
as an electronic engineer, I want to explain. Thermography, what it does is takes the temperature of whatever it sees, so it cannot penetrate. That's the thing. So that's what is excellent for breast cancer and other superficial organs that may have a tumor. But the pineal gland is in the middle of the head.
Yeah.
So, but this I would love something to detect that.
Yeah.
All right. I will go to another question. And who should have a thermal scan, or who would benefit from one? I think you covered that.
Mm-hmm.
Everyone.
Yeah, we do babies, newborns. Frequently they have, oddly enough, a lot of the newborns have pyloric valve disorders where the pyloric valve is not opening properly. So some of them early on will be, it'll be confused as being that they have, difficulties in eating. They're throwing up repetitively because the valve literally is not opening in a proper format. Part of that also, pyloric ileocecal valve is controlled by the vagus nerve. So these can be upper cervical related issues where the communication to that nerve by way of the vagus nerve controlling the pyloric valve can be a problem. So depending on the birth, how the birth was performed, if they're using forceps, in many cases there's a lot of trauma to the upper cervical after such of an abusive delivery.
You know, another thing I really get excited about is, you know, how the first thing the doctor wants to do, because kids get ear infections, is put the tubes in, and how we can help them with thermal imaging.
Yeah.
And you can finish on that, but we should be thermal imaging more children, not X-raying them.
Yeah. You know, in many cases, this inner ear issue, it's odd to me that so many kids are having these tubes put into the ears to aerate the inner ear when it hasn't really fixed the problem. The problem is an improper opening of the eustachian tube. Why aren't they fixing the eustachian tube and the communication to the eustachian tube? It's just absolutely mind-boggling that this type of care, or the lack thereof, is being performed every day. And so inner ear issues regarding a proper or improper opening of the eustachian tube is a very common, and it happens in older individuals and happens in young individuals, where taking an antibiotic, frequently these are fungus-infested disorders. So if they're giving the child an antibiotic, actually makes them worse.
This is very enlightening.
Gallbladder. Another one.
All right.
There's too many gallbladders.
So it has many more applications than we thought.
Yeah.
All right. How about patterns of heavy metals in body? Would that be inflammation showing in gut and brain? However, in the gut, it could also be bacteria imbalances. So, is there any patterns where one may say it looks like a heavy metals?
Yeah, I would say that we wouldn't be able to differentiate regarding that examination other than is it affecting the kidney. Frequently the kidney is used to filter out some of this. Some of them have skin reactive responses where the skin is trying to get rid of some of these heavy metals. This is where you're using a far infrared sauna in order to facilitate the skin to get rid of some of these, but to really to render a diagnostic through a thermal regarding heavy metals, it wouldn't be that specific about that type of. It would be more about what is the effect. For example, the effect would be the inflammatory features. If there's lead, frequently they'll have issues regarding the tongue, and some of the lymph nodes around the jawline would be affected. And then, of course, we would look at kidney markers. But other than that, I wouldn't be able to diagnose it through the thermal itself.
All right, this is the last chance to ask a question. People on the free conference call, you have to press 5*. And in Facebook and YouTube, you type your question. Last question of the day. How accurate it is, thermography? Is there any statistical accuracy that you would say is it possible to estimate? This is not a very specific question. What I would say is how much more information can a woman who has a concern on a breast can have that will help her to decide, okay, do I have to do a biopsy or not by using thermography? How much information that will give this knowledge that they need?
Mm. Yeah, I think, again, some of the early studies that were done in the 90s regarding the conjunction of both mammograms and thermography, they were estimating 97% sensitivity and specificity was documented. It's just that it's like you're taking one step forward with thermography, but you're taking 2 steps back with the mammography. So how much good compared to how much harm are being performed with such a tool that you can only get 40 to 60% of the breast in the image, and you can't examine the axillary. There's so many, and yet at the end, where is the blood and lymph forwarded? Inevitably, it's going into the neck, into the subclavian vein, which obviously a mammogram doesn't use any examination regarding that area. So I think when you look at, when you compare of what the value of the imaging has more to do with what is the agenda. What is our agenda regarding breast cancer? And it's not as much about the breast cancer, it's more about addressing the precursors to breast cancer. Those things that you can't see with the mammogram. Those things that you can't address if you're using a mammogram, an ultrasound, or an MR, that there's nothing to do other than to try to find your cancer. And the cause of your cancer, wherever that may be, the cause of it isn't where the cancer is. It has a body wrapped around it that sets the stage that allows the cancer to either be killed or not. And then how do we change that? By changing the inflammatory, the lymph congestive characteristic to those regions. And so, oddly enough, much to do with the breast actually has to do with the muscles around the neck. And so it's very odd to me that where and what the common denominator of where cancer lies has more to do with arm dominance. Is very intriguing to me, and is not a question that is commonly asked about in those that are doing mammograms and ultrasounds.
Well, talking about accuracy, I've seen, and talking to Dr. Jeffrey Preistupa, many young women in their 20s, 30s, diagnosed, rushed to a surgery when maybe, and I'm pretty sure in maybe 90% of the cases, a thermography will rule out if that was a cancer or not. So,
well, and not so much it's cancer, but more of its aggressive behavior there, Carlos. And this is why the terminology is about tissue behavior. And so, yes, they may have abnormal cells like DCIS, ductal carcinoma in situ, has a 96% probability of never going into an aggressive characteristic. Does it have abnormal cells in it? It may have abnormal cells within it, but the body has done its job in restricting its aggressive behavior. So the motive, our motive regarding thermography, and those that use it knows that it's not as much of finding cancer, but it's identifying its behavior and what are the contributing factors that cause it.
We are done the hour. It was packed with incredible information. I never thought you were going to be able to answer all these questions. I want to give a special thanks to a volunteer who came today to help us with managing the Facebook, the YouTube, the free conference call. I've been under so much stress lately every time that I do this. So thank you, Janet. She is in the back helping us, and she also works with patients with cancer doing coaching. Anything else you would like to add? This is just to this audience. What would you like to add to finish this Q&A?
Yeah, I think at the end, what our motives shows what our motives are regarding people's health. And it's like hitting a home run. So often, many of you may be hitting 2 or 3 bases and think that you're still going to hit a home run. And what I'm going to say is that you need to know what all the bases are. And so what thermography does, it gives you a clarity. Are you missing some of the bases that you didn't realize that were there? And so I think the imaging should not be a scary process. It's really, the motive is about informing So then you identify what things that we may be missing in your health that could be satisfied if you just knew about it. So that's what we're up to. Anything else there, Linda?
Yeah, I just wanted to add that most of the technicians that we have, or a lot of the technicians, I shouldn't say most, but are because they heard a webinar like this, or they heard us speak, and they realized they never had to have that mastectomy. And they come to me, and they want to learn thermal imaging so they can educate women about this amazing test. I have so many women that have had mastectomies that never heard the truth. We have one great one, she's in Arizona, Carrie Press. Amazing speaker, amazing testimony, amazing career with thermal imaging.
Yeah.
We just need more women out there educating those because they don't know. I can't tell you how many women I talk to that never even heard of it.
Yeah.
They don't even know there's something else they can be doing.
Yeah.
Exactly. And this is why thermography is so crucial nowadays. So, ladies and gentlemen, again, thermography is inexpensive and will give you all the information that you need to know. Do I have cancer or not? Thank you so much, Linda and Gregory.
Gracias.
That was
Gracias.
that was really enlightening, educating people. I want to mention that this is the third Q&A on thermography, and this is the time that we have the most questions. That means that this education is working because more people are interested. And the other thing that I want to mention, this is not just for women. Actually, men has to be very involved because I remember when I was in the cancer clinic working there, we have 3 women who came from other states with their husbands who were surgeons to have a hyperthermia because the husband didn't want them to go to mastectomy. So anyway, thank you so much, and I will be in touch with you, and I really appreciate everything. Bye everyone.